Well, welcome to this talk. Now, I've had numerous requests to talk about the Nipah virus, which is currently causing concern in parts of Asia. The World Health Organization, for example, says it's got epidemic potential. So is this a real risk? Should we be worried about it? Is it coming to Western countries? And the answer to this question is yes, it is a risk. And no, I don't think it is much of a risk at the moment, actually. The reason I'm saying yes, it is a potential risk is it could be weaponized, it could be messed around with in the laboratories, gain-of-function research could be carried out on it, it would leak. And then of course, it would be a significant risk. And also there is a small risk that the virus would mutate in nature and cause a greater risk, although that risk is relatively small. Although with more encroachment into natural habitats, that risk increases. So do I think we're going to see cases of Nipah virus spreading person to person in the United States, Canada, Australia, United Kingdom? No, I don't given the information we have at the moment. So that is what this video is about. If you're worried about Nipah virus spreading in the West, I would stop worrying, at least for the time being until new information comes to light. If you want more information and the rationale and the references for that, do stick around because it really is quite interesting. Now this is the natural host here, this good-looking chap, the fruit bat, or sometimes called the flying fox for fairly obvious reasons. Nipah virus is what we call a zoonotic virus, which means it originates in animals and can then spill over to humans. Its natural reservoir, where it lives quite happily without causing much trouble, is in these fruit bats. The transmission to humans often happens in quite specific ways. 1. Common route is through contaminated food. For example, if these bats are feeding on fruit or licking the sap from date palm trees, they can leave behind their saliva, urine, or feces, which can be contaminated with the virus. If a person then consumes that fruit without washing it, or drinks the raw date palm sap, which is a delicacy in some regions, they can become infected. It's a very direct route from the bat to the human. Another pathway involves an intermediate host. We've seen outbreaks where the virus first spread from bats to pigs. The pigs get sick, and then farm workers or people handling the infected pigs can contract the virus. So there are these multiple routes of transmission from its natural animal host into the human population. Now, what makes health authorities so concerned about Nipah is its exceptionally high fatality rate. This is not like many other viruses we're familiar with. The mortality rate for Nipah virus is alarmingly high, often ranging from 40% up to 75%. In some outbreaks, it has been recorded as even higher than that. This means that for every 10 people who get infected, between 4 and 7, or even more, may not survive. This lethality is one of the primary reasons why it is classified as a high-priority pathogen by global health organizations. It's the sheer severity of the illness that makes any outbreak, no matter how small, a major public health emergency. When a virus has a fatality rate this high, containing its spread becomes absolutely critical. When a person has become infected, the symptoms they experience can be quite severe. Initially, it might present like many other common illnesses, with flu-like symptoms. This can include a high fever, headaches, muscle pain, and general respiratory distress, which can make early diagnosis difficult. However, as the disease progresses, it often takes a much more serious turn. In severe cases, the Nipah virus attacks the central nervous system. This leads to a condition called encephalitis, which is an inflammation of the brain. When the brain becomes inflamed, the consequences are devastating. Patients can experience confusion, disorientation, drowsiness, and then progress to seizures and eventually fall into a coma. This neurological damage is what accounts for the virus's high mortality rate. And even for those who do survive, they can be left with long-term neurological problems. This brings us to the question of pandemic risk. Currently, human-to-human transmission of Nipah virus is relatively limited. It's not nearly as transmissible as something like COVID-19 or influenza. It typically requires very close contact with an infected person's bodily fluids, for example, a family member caring for a sick relative or a healthcare worker. It doesn't seem to spread effectively through the air over long distances. However, and this is where the concern lies, there is a risk of this changing. Dr. Campbell and other experts have warned about the potential for the virus to mutate. A natural mutation could occur that makes it more transmissible between people, perhaps enabling it to spread through respiratory droplets, which would dramatically increase its pandemic potential. The other significant danger is the possibility of gain-of-function research, where the virus is deliberately modified in a laboratory to become more transmissible. A lab leak of such an enhanced virus would be a catastrophic scenario. So, while the current risk is contained, the potential for it to become a much bigger threat is very real. Given these risks, prevention is absolutely key, especially in areas where the virus is known to circulate. The advice is quite practical and focuses on breaking the chains of transmission. A primary recommendation is to avoid eating fruits that show any signs of being bitten by animals or bats. Any produce should be thoroughly washed, and if possible, peeled before it is consumed. Another critical measure, particularly in regions where date palm sap is harvested, is to avoid drinking it raw. Boiling the sap can kill the virus. And of course, in a healthcare setting or when caring for someone who is sick with Nipah, strict hygiene and the use of personal protective equipment are paramount to prevent further spread. These simple but effective public health measures are our best defense against this dangerous virus, and they help ensure that small outbreaks do not spiral into larger epidemics.